Hey there, chemistry students. My name is Jennifer, and my partner Karash and I are going to be presenting a little PowerPoint on the application of chemistry and dentistry. So just to give you a brief outline of what we're going to be talking about, we're going to start off with some dental cements, then we're going to head into water fluoridation and mouthwashes. After that, we're going to talk about radionuclide bone imaging, oxyhemoglobin dissociation curve graphs, and finally some local anesthesia. Dental cements are used for a variety of dental applications, such as eluting agents, pulp protecting agents, and cavity lining materials. They are also used to form an insulating layer under metallic or ceramic restorations, and they protect the pulp from injury. Pulp refers to the center of the tooth made of living soft tissue. Dental cements are hard, brittle materials formed by mixing powder and liquid together. Zinc oxide eugenol, also known as ZOE, is one of the major dental cement systems used by dentists. ZOE can be used as a filling or cement material in dentistry, as mentioned previously. It is often used in dentistry when the tooth decay or cavity is very deep or very close to the pulp. This is because the tissue inside the tooth reacts badly to the drilling of dental equipment. Because of this, it frequently becomes severely inflamed and precipitates a condition called chronic pulpitis. Pulpitis usually leads to severe chronic tooth sensitivity or actual toothache, and can then only be treated with root canal therapy. The placement of a ZOE, temporary, for a few to several days prior to the placement of the final filling usually prevents the sensitivity or toothache, and therefore, most times, precludes the need for the expensive and time-consuming root canal procedure. Zinc oxide eugenol is a material created by the combination of zinc oxide and eugenol, which can be found in the olive of cloves. The reaction is catalyzed by water and is accelerated by the presence of metal salts. It is an acid-base reaction where zinc oxide acts as the base and eugenol as the acid, which results in the formation of zinc eugenolate chelate salts and water. In a simple ZOE cement, the overall reaction may be represented by what you see on your screen. Since water is generated in this reaction and is also known to promote it, this reaction can be regarded as an autocatalytic one.
Last but not least, local anesthesia in dentistry using lidocaine. Now, local anesthetics are an important tool.
Dental caries, also known as tooth decay or cavities, remain a major public health concern in most industrialized countries. Water fluoridation prevents cavities in both children and adults. Water fluoridation involves the intentional dosing of municipal water supplies with fluoride. Water has fluoride at a level that is effective for preventing cavities, approximately 1 part in a million by weight. Although water fluoridation can cause dental fluorosis, which can alter the appearance of developing teeth, most of this is mild, and fluoridated water operates on tooth surfaces. In the mouth, it creates low levels of fluoride in saliva, which reduces the rate at which tooth enamel demineralizes and increases the rate at which it remineralizes in the early stages of cavities. So technically, fluoride does not prevent cavities, but rather controls the rate at which they develop. Fluoridation does not affect the appearance, taste, or smell of drinking water. It is normally accomplished by adding one of 3 compounds to the water: sodium fluoride, fluorosilicic acid, or sodium fluorosilicate. Note, these compounds were chosen for their solubility, safety, availability, and low cost. As mentioned in Chapter 10.1 in the Single Displacement Thought Lab, we can relate this to fluoridation because when fluoride is ingested, a single displacement reaction forms. Teeth are hard, and this hardness is caused by a form of calcium called hydroxyapatite. Hydroxyapatite is very susceptible to acid attack. The sugar you eat is metabolized to a dilute acid in your mouth by the germs in plaque. Hydroxyapatite is also quite susceptible to attack by free fluoride ions as well. But instead of causing destruction of the hydroxyapatite crystals, it causes their transformation into fluoroapatite. These fluoride ions essentially substitute themselves for the hydroxyl groups in the hydroxyapatite in a single displacement reaction. Fluoroapatite has most of the same characteristics as hydroxyapatite, but is quite resistant to attack by acid. Thus, rinsing the mouth with fluoride-containing mouthwashes and toothpaste coats the outside of the teeth with a layer of acid-resistant fluoroapatite. In addition, the fluoride will penetrate under leaky fillings and partially remineralize the decay underneath them. When used as a mouthwash, hydrogen peroxide can kill the germs and bacteria inside the mouth to eliminate problems like bad breath and gingivitis. Hydrogen peroxide mouthwash is excellent for destroying the germs and bacteria that cause plaque and caries as well. Hence, using hydrogen peroxide mouthwash can effectively reduce the incidence of common dental and gum diseases like gingivitis. Along with killing harmful bacteria and microorganisms, hydrogen peroxide can also bleach or whiten the teeth due to its strong bleaching properties. So you can use hydrogen peroxide for mouthwash to not only enhance oral hygiene, but whiten your teeth as well. Hydrogen peroxide can be used directly as a mouthwash, or you can use a commercial mouthwash with hydrogen peroxide as an active ingredient. But getting a bottle of hydrogen peroxide from a medical store and using it as a mouthwash is a much less expensive option. It is recommended that 3% hydrogen peroxide solution is to be used for health purposes and mixed with equal parts water. The environment of a mouth is slightly basic. The mouth's acidity is affected by hydrogen peroxide, and so there is a limit to how concentrated the mouthwash can be. This value can be calculated using the concept learned in Chapter 9, in which we use the base dissociation constant to find the unknown concentration of products or reactants. Here the concentration of hydronium ions, the pH range, is known and the initial concentration of the base needs to be calculated.
Now that Jennifer went through all her 3 topics, let me get started with oxyhemoglobin dissociation curve. One of the most important biological molecules is hemoglobin, which exists in the blood. Its primary function is to transport oxygen. Now each hemoglobin molecule consists of 4 polypeptide chain and can bond to a maximum number of 4 oxygen molecules. Hemoglobin and oxygen are at an equilibrium in the blood, and the equilibrium equation is shown in this slide. If hemoglobin does not bond to its maximum capacity of oxygen molecules, according to Le Chatelier's principle, which you learn in Chapter 7, the equilibrium will shift to the left, resulting in a higher concentration of free oxygen molecules in the blood. When there is more free oxygen, that means tissues are receiving less oxygen. That is dangerous. The primary factor that determines how much oxygen is actually bound to hemoglobin is the partial pressure of oxygen, that is denoted by PaO2 in this graph, which is actually the concentration of free oxygen. When every oxygen binding site and all the hemoglobin molecules are occupied, the blood is said to be 100% saturated. During dental surgeries that involve anesthesia, this partial pressure is constantly monitored. Sensors are connected to the patient, and if this concentration level drop within below a certain range, the dentist would take serious actions. Radionuclide bone imaging. The discoveries of the atomic nucleus and other nuclear particles such as protons, electrons, and neutrons have definitely helped dentistry. Based on the different atomic models which were proposed over a course of time, and we studied them in Chapter 3, different imaging methods have been developed that are commonly used in diagnostic medicine and dentistry today. They provide one of the few practical methods for studying the limited metabolic activities of bones and teeth. They are commonly used before surgeries to confirm a diagnosis and also to view specific details of the structure of the jaw. Now here are some examples of skeletal imaging of different parts of the jaw. They're also very commonly used when dentists want to decide whether a patient needs orthodontics. The patient will look for the positioning of the teeth in the mouth and the amount of space available in the upper jaw and the lower one as well. Radionuclide skeletal scanning has proved to be a valuable and beneficial tool in early and differential diagnosis of maxillofacial lesions. Last but not least, local anesthesia in dentistry using lidocaine. Now, local anesthetics are an important tool for the control of pain and discomfort during dental treatment. They create a chemical roadblock between the source of the pain or stimulation and the brain. At the cellular level, this occurs by blocking protein channels that transport sodium in the nerve cell's membrane. Now, we know that sodium is necessary for signal propagation, so when this happens, nerve signals, which are in this case feelings of pain, are not transmitted anymore. Lidocaine is one of the most commonly used local anesthetics. It is available in different forms and concentrations. Dentists use different concentrations for different surgeries. For example, if a dentist wants to pull out a regular canine tooth, he will use a lower concentration than when pulling out a wisdom tooth. And that is because pulling out a wisdom tooth usually requires a surgery that is much longer. And so the numbness should last for much longer. Just like when surgeons use gases in operation rooms to conduct anesthesia, it is crucial for the dentist to make an informed decision as to what the suitable concentration for the situation is. In anesthetics, there is a hypothesis called pH partition hypothesis that states only non-ionized, non-polar form of a drug is sufficiently lipophilic to be able to diffuse across a biological bilayer, such as the lipid membrane of a neural cell. This hypothesis provides a qualitative view of what might be happening to lidocaine diffusion at a cellular level, because an uncharged lidocaine molecule diffuses across a neural cell membrane more rapidly than a charged molecule. Lidocaine contains an amine group which makes it slightly basic. Now, pKb, which we studied in chapter 8.3, is a logarithmic measure of the base dissociation constant. So basically, lidocaine has a specific Kb which allows the dentists to measure or to get an idea of how quickly or how much of it dissociates into its ionic form and how much of it does not, because it's only the non-polar, non-ionized part of it that will be effective in making the patient mouth numb. Now, the pKb of lidocaine can be calculated using the Henderson-Hasselbalch equation, which we had a glance on in our lab number 9. In this equation, B is the concentration of non-iodized base, and BH plus is the concentration of a positively charged ion. And thanks for watching. We hope you've learned something new.